From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Kate Walsh. November is Lung Cancer Awareness Month. Lung cancer is the leading cancer killer in the world, killing more people than breast, colorectal, and prostate cancers combined. And while smoking is considered one of the most common contributing factors to lung diseases, people can develop lung diseases without ever having smoked. So this week on 22 News in Focus, we'll be learning about the threat of not only lung cancer, but other pulmonary diseases that impact millions of Americans each day. We'll be discussing the prevention, diagnosis, and treatment of these diseases and conditions as well. And then later in the program, we'll find out about support services available for patients, their families, and caregivers. So first, joining me to talk about the diagnosis and treatment and all the medical aspects are Dr. Victor Pinto-Plata, Chief of Pulmonary Critical Care at Bay State Medical Center, and Dr. Wilson Merton, Vice President and Medical Director at the Bay State Regional Cancer Program. So thank you both for joining us. We know you're very busy men at the hospital.
Thank you for the invitation.
Thank you.
Of course. So first, let's talk about the basics. What is lung cancer when we talk about it? It's not just a simple diagnosis, right? I'm sure there's many different types and stages of it. So let's talk about that first.
Well, most lung cancers are actually malignancies of the windpipes that are in the lung. Their presentation is unfortunately, because the lung doesn't feel pain, is limited to patients who have cough or weight loss, or if the cancer does spread, affects in those organs. So that's one of the reasons why we tend to find lung cancers at a relatively advanced stage. Even today, the majority of patients who are diagnosed with lung cancer are not curable by surgery. So it's not really limited disease. And that's really, I think, the driver behind the high mortality rates that we've experienced thus far.
So if it's caught early enough, it might be something that people can survive from just as they would other cancers. It's the fact that they're caught too late.
Absolutely. If we have a relatively small tumor, cure rates can be very high. But as the tumor grows, the likelihood of other organs or lymph nodes being involved, which precludes the ability of a surgeon to actually remove all the disease, then cure rates start to drop.
And I feel like we do often hear that a lung cancer then spreads to other parts of the body. Why is it that it spreads?
Well, cancer cells have different characteristics. They don't really adhere very well. They tend to have characteristics that allow themselves to get into vessels, such as lymphatics that go to lymph nodes, or blood vessels that carry cells elsewhere. And different cells have different ability to adhere to different organs. So actually spreading to different organs is a challenge for the cancer cell, but the numbers of cancer cells that get into the bloodstream are very large, and even tiny cancer that we would not be able to pick up on scanning can put 1 million cancer cells into the bloodstream a day. Well, why is it that we're not all dead of cancer? We're not, because cancer cells are not normal cells and they tend to die very quickly. In most solid tumors, lung cancer no exception, as these cancer cells divide, 70 to 90% of those cancer cells just die because they're not normal. But it's the relentless progression, production of cells that eventually allows cancer cells to stick somewhere and survive.
So are you saying that a lot of us would have some cancer cells going through our body, but they just don't do anything because we don't have tumors, or maybe there's not enough of them to cause problems?
Or they just die, or the immune system gets rid of them. And that's probably a daily basis.
Wow, interesting. How prevalent are cases of lung cancer at Bay State Medical Center? Is this, I know it's across the country, it's the deadliest form of cancer. Is that also the trend in Massachusetts and Western Massachusetts as well?
Yeah, it is. I mean, in our tumor registry, we would see at Bay State Medical Center a little shy of 200 cases of lung cancer a year.
New cases?
New cases per year. So that probably represents about 8%, 9% of our tumor registry numbers here at Bay State, but they are a disproportionate cause of mortality.
And when we're talking about cancers spreading from lung cancer to other parts of the body, would it also be the same case where a cancer would start somewhere else in the body and then go to the lungs?
That's very frequently the case, but we use our naming conventions to clarify that. Often patients will say, well, my mom had breast cancer, and then she had lung cancer, and then she had bone cancer. Well, the probable fact is that she didn't have 3 different cancers. She had breast cancer that spread to lung and bone, what we call metastasis or secondary tumors. So our view is that when we say lung cancer, what we really mean is a cancer that started growing in the lung and then may have spread somewhere else. So we try to clarify that, and because the treatments and the management are very different.
So what, if you could explain this, what are some of the symptoms that people do have? You said that there's no pain in the lung, so how do they know if they have lung cancer?
Yeah, well, so one of the things that we see is that the patients may have cough. Sometimes they may have a thoracic pain, a pain in the chest. Sometimes when the disease is advanced, as we discussed, unfortunately they present with cough, phlegm, and blood. And in cases that are even more advanced, patient will start having weight loss. And as we have discussed today, unfortunately, sometimes it's just find out from a chest X-ray that was done for another reason. And then you find an abnormality on the X-ray, and then that's when you start looking for the possible diagnosis, and lung cancer is obviously one of them.
Would it be something like people come in with pneumonia or something like that, and then?
Absolutely. So, for example, some of patients may be presenting with a pneumonia, and we give antibiotics, patient get discharged, and we always like to have a follow-up visit in the office after that. And then, so 4 or 6 weeks goes by, and when we get a repeat X-ray, even though the patient have no symptoms, we still see the changes in the lung, and we say, okay, this is probably was not just a pneumonia, was probably a lung mass, a cancer that was obstructing the windpipe, and then the patient developed a pneumonia, but in fact the initial problem was a lung cancer. So that's another way of this disease presenting, unfortunately.
And so at that point, would the person, is that a death sentence, or are there a lot of things people can do at that point?
No, there is a lot of things people can do. So as we have discussed, the first thing is obviously to try to make the diagnosis, and we have several ways to reach that diagnosis, and what we call the staging. Try to determine how, if the cancer has spread, and if it has spread to what organs. And we have a tendency to say if it's limited in the chest, it's good, but if it's outside the chest, then it's metastasis that we have already mentioned. So the idea is try to make a diagnosis early. And for that reason, at Bay State Medical Center, we have a lung cancer screening program, and that is for patients who are a smoker or ex-smoker that have certain quantity of cigarette that they have smoked through their life, and between the age of 55 or 50 to 77, they will get a CAT scan every year to try to make this diagnosis early. I always tell my patients, and it's like a mammography. Every year, for preventive therapy, women should have a mammography done. So this is exactly what we do.
And that's for people who are at maybe a higher risk due to
absolutely.
Smoking cancer.
So those are
smoking cigarettes.
Yes, smoking cigarettes. So those are patients who are current or ex-smoker, and that have certain number of what we call packs per year. So we make that determination, and then we follow them for many years. We say yearly CAT scan.
And so if people, let's say they smoked from when they were 18 to 35, but then they quit, is that quitting at that point helping at all? It really will make a difference.
It makes a difference not only for lung cancer, but a whole variety of other smoking-related diseases. So if you look at the increased risk associated with smoking, when smokers quit, that risk starts to drop. And while it doesn't get exactly to what a never smoker risk of developing these diseases would be, it gets close. So it's really worth doing. It takes 12 or 13 years to get to that reduced risk for lung cancer, but the benefits in terms of heart disease, stroke, and other cancers in the head and neck, the esophagus, bladder, kidney, and then smaller effects in other organs, including breast cancer, is pretty significant.
Is the lung the type of organ where it heals itself? Or I remember going to museums when I was a kid, and they always show the lungs of a smoker versus a lung of someone who's never smoked, and they show the damage. But is there any way that it can reverse that damage and heal?
Yeah, so the best thing is, as we have discussed, is quitting smoking.
Right.
And quitting, the faster is the better. There are obviously other diseases like COPD, chronic obstructive pulmonary disease associated to smoking. So the early the patient quits, the most likely is for the lung function to improve. When you develop emphysema, which is this probably what you saw in the museum, some holes in the lung, they don't heal, but the patient's symptoms will get better, the lung function capacity will get better, and not to mention the likelihood or the probability of getting other cancers of other diseases, heart, etc., is improved by doing that measure.
All right, interesting. We're going to take a break, and when we come back, we'll continue our conversation with the doctor. So you're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about lung diseases, prevention, diagnosis, and treatments as part of November being Lung Cancer Awareness Month. And we were talking about lung cancer in particular, and before we go on to other diseases about having to do with the lungs, one of the topics that's kind of a hot topic right now is the use of marijuana and medical marijuana. But of course, if you're not taking it as an edible, you're smoking it, and we know that smoking is bad. So how does that play into prescribing that as a way of, pain management and getting lung cancer?
Yeah, so we have not found a straight direction or connection between lung cancer and marijuana. But as we were discussing previously, when you smoke, you're bringing products of this smoking that are toxic. And it does affect the airways, the windpipe. And one of the effects that we know is clearly associated to marijuana is symptoms of chronic bronchitis, where patients have cough, produce phlegm. And in fact, these are the first symptoms that patients who end up developing COPD, chronic obstructive pulmonary disease, is what they have. So in the long term, as I say, there is no straight connection, but there is obviously clear evidence that smoking marijuana is, for example, associated to some respiratory conditions besides chronic bronchitis, infectious. There is a fungus called Aspergillus that can affect the lung and is there in the marijuana. So we do not encourage people to smoke, because there is also an association between starting with one marijuana and then going and obviously using other products, including tobacco.
Okay, interesting. When it comes to lung cancer, when someone is diagnosed with it, what are some of their treatment options?
Well, it depends on the stage or extent of the disease and the subtypes of cancer, and then some subtypes of that. Lung cancer is the one cancer that has really benefited from molecular testing and looking for mutations in genes that could be a driver for the disease. For most patients, that would be an opportunity if they are a light or never smoker. Patients who smoke tend not to have a single mutation in a gene, but rather many mutations that tend to drive things. But overall, for lung cancer, perhaps 10 or 12% of lung cancer patients might have a mutation in a gene that, if we have a drug, can shut that down and improve survival. The other big advance over the past few years is immune therapy, using antibodies to prevent or absorb proteins that cancers produce to try and shut the immune system down. Cancers try to use stealth technology to avoid the immune system to detect them. Wow. And these antibodies frustrate that, and that's really been a game changer for increasing number of patients.
What about people who have never smoked their entire life but have lung cancer? Is that something that's, you know, hereditary? They're just prone to it? Or why would they get lung cancer if it started in their lungs?
Yeah, before tobacco was used in great volumes, so up to the middle of the 19th century, before the Civil War, when you look at family pedigrees, and this is hard to do because there weren't big computer databases, obviously, or scanning, but lung cancer appeared to be a familial disease, and that whole appearance disappeared as patients started using tobacco in great volume, and that became the #1 and still is the #1 driver for lung cancer. But we have now, through mutational analysis and genetic testing, found a couple of genes that seem to be associated with familial lung cancer. Again, very uncommon to rare in our society. The overwhelming majority of lung cancer is smoking related or not smoking related, but not familial. But there is a small background. It's lousy luck for non-smokers to get lung cancer. Yeah. It's uncommon, but some cell developed a mutation in a gene. We may or may not be able to determine whether that's the case or not, and the cell didn't manage to do the right thing and die, and ultimately cause the problem. So it is not a case, certainly as we speak, that patients are responsible for their lung cancer. It's lousy luck, and even smokers. Right. Lousy luck. If you look at all smokers, between 4% and 6% will develop lung cancer. Now, they develop a lot of other ailments, but it's not universal that people who smoke get lung cancer. But if you get lung cancer, you've got yourself a major problem.
Right. Yeah, let's talk about other diseases as well having to do with the lungs. So COPD, that's kind of an umbrella term with many other things as part of that, right? So can you talk about the different types of COPD people may have and what that means?
Yeah, so the terms translate into chronic obstructed pulmonary disease. So those are diseases of the lungs where there is airway obstruction, and are like 95% of them associated to smoking. But what we have learned is that sometimes, just as you mentioned for lung cancer, that there are patients who develop lung cancer without smoking. Certainly in COPD, there are patients who develop COPD with never been a smoker. And then we start to analyze why that happens, and we have come to a conclusion that the disease probably doesn't start when you are in your 40s or 50s. Maybe it starts when you're in utero. If your mother smoked, there is evidence that there are people whose lung function never developed, the lungs never develop in total. Okay. So they start with a lower lung function compared to people who were never exposed to tobacco.
But they still kind of were related to smoking just through the mother.
Absolutely, not just directly. So that's why when we look at a registry of patients, you know, with a history of COPD, we'll see, well, how come you have patients who are, say, 50 years of age, and you have this person who has such a reduced lung function, and then you have other people who are 70 years old and have the same level. So you say, how come it happens so quickly? Well, we have published in this area and have noticed that, in fact, you can get to COPD different ways. We should not forget, outside America, a lot of people do not smoke, but get exposed to what we call biomass, cook with wood, and then the smoke doesn't leave the house, so they inhale that, and for years of doing that, they can also develop COPD.
Wow. Would that be more like third world countries doing that without the right ventilation?
So if we go, absolutely. So if you go outside America, in third world countries, that's one of the most frequent reasons why people develop COPD. So here in America, it's mostly associated to the use of tobacco. You know, there are people who obviously have more predisposition to have it. You may see patients that are smoking and don't have it. So it's around 20% of the smokers who will develop COPD. But still, the most important thing that people should get out of this program is that you should not smoke. If you smoke, you should try to quit as early as you can, and that there is help. that we can help patients quitting by different methods.
And we'll talk about that too a little bit later on with representatives from the American Lung Association. But while I have you guys here, asthma. We haven't talked about asthma, and that's obviously something that's affecting a lot of people. And we always have these studies about how the Pioneer Valley in particular, for some reason, has maybe a higher risk of asthma or higher cases of asthma than other parts of the country. Why would that be?
Yeah, so it is not totally clear why we have a high incidence of asthma. There is some familiar predisposition for patients with asthma. We also see some association between obesity and asthma, particularly difficulty to try to treat those patients. We have a high proportion of patients from Latin America, particularly from Puerto Rico, living in this area, and there is not a certain predisposition, but what we see is that the environment is very important. Exposure to rodents, to cockroach, to even things in the like pollen can predispose patients to have asthma, and what is also interesting in this area is whether patients, besides being asthmatic and knowing that they have asthma, unfortunately, they still smoke, which also make the asthma more difficult to control.
Wow. And if people have asthma, are they more likely to get lung cancer, or is there no real correlation between?
Pure asthma without a tobacco tie-in, not really.
Okay.
But if there's a tobacco tie-in and you have asthma, but there's more of chronic bronchitis, COPD aspect, then yeah, but it's the tobacco that's driving that really, not the lung function issue. So the lung function is affected by tobacco and the environment, and the cancer is affected by tobacco and occasionally, to a certain extent, complementary to the environment, and that's where the link is.
Yeah. Well, we have also seen in this lung cancer screening program that if the patient has emphysema, it is more likely that if we see an abnormality in the CAT scan, a nodule, that nodule is malignant. There is 4 to 5 times higher risk of having lung cancer if you have emphysema than if you don't have it. Wow. So these two diseases go together, unfortunately, yes.
Very interesting. Thank you so much for being here today and sharing all that information. We learned a lot, I know. And so we're going to take a break, and when we come back, we'll talk about all the support programs and awareness being done in this area to help people suffering from a lung disease and their families. You're watching 22 News in Focus. Watching 22 News in Focus, and today we're talking about lung cancer and other lung diseases as part of Lung Cancer Awareness Month. We've just discussed the diagnosis and treatment of several lung disorders, particularly lung cancer. The American Lung Association was founded over 100 years ago to help save lives by improving lung health and preventing lung disease through research, education, and advocacy. They also provide supportive services and resources to patients, their families, and caregivers. So joining me now to talk about the mission of the American Lung Association and their programs are Ruth Kanavi, Director of Public Policy in Connecticut, Mary Mackey, Development Manager in Connecticut, and Amber Pelletier, Director of Health Education in Massachusetts, again, all for the American Lung Association. So thank you three for being here. And we have a lot to discuss. I know my eyes were opened in the past 2 segments talking to the doctors. You all know that and so much more, so I'd like to hear what you have to say. So first of all, give me some background on the American Lung Association and the different chapters, as well as why each of you decided to be a part of it. So we'll just go down the line. It'll make it easier.
Certainly. So I actually am very unique to the organization. My father actually has a lung disease and had a double lung transplant just almost 2 years ago. So very connected to our mission, and I work here in Massachusetts on all of our educational events, which I'm sure we'll talk a little bit more about.
Excellent.
And I work with members of the community to kind of mobilize them and get them on board to be engaged and feel empowered to make a difference. So there's the awareness component of that, which we'll talk a little bit about, the education component, and again, just empowering them to make a difference.
And do you have a personal connection to the association, or just something that you feel passionate about?
I'm very passionate about it because I do have a personal connection. I myself have asthma. So.
Okay.
And again, so I do public policy work for the Lung Association, and very passionate about that. I think we can make big difference on people's lung health by making big policy changes and helping people get access to care and try to prevent lung disease in the first place. And so I also have a personal connection. I think most people that we know have personal connections. Lung disease is a real significant issue, and so I lost an uncle from lung cancer many years ago, but it was very difficult. And so personal connection, and it's exciting to be part of an organization that's been around for so long and has really made a difference in people's lives.
And the color, the turquoise color, is the color, right? I tried to wear that today.
Yes, I know, we
purpose,
appreciate that.
But I know that that's part of raising awareness for your mission. And honestly, having not known much of what the doctors were saying, I feel like that just goes to show a lot more needs to be done to raise awareness of things that happen to so many people, and it's the deadliest type of cancer. So what do you try to do, each of you, to make sure that that mission is out there, and what kind of programs are there?
So the turquoise is actually for our Lung Force movement, which is a new movement. And one of the things that we do with that movement, and kind of my area, my job, is Lung Force Expos. So we recently just wrapped up our expo in Boston. We actually had a great group from this area come, and then we have an upcoming one in Connecticut in the springtime. But really what the Lung Force Expo is it's an opportunity for us to bring together patients, caregivers, professionals, and talk about the latest in treatments, research, everything that's going on in the lung health world, to really raise awareness and make sure people are up to date on what's going on, and really just kind of staying on top of their risk factors. We have a lot of COPD patients who come to the expos as well, but just trying to really spread awareness. It's a big part of the movement, and Mary can talk about the walk as well.
Right, so we've touched a little bit about the Lung Force Initiative. So the Lung Force Initiative really, you know, there's plenty of opportunity, as we talked about, in terms of the prevalence. So the Lung Force Initiative focuses on elevating, raising awareness, really has the multi-pronged approach to addressing lung disease. So there's the, you know, education component, really empowering patients and caregivers, making sure they get equipped with the tools to help them in their journey with lung disease. There's raising awareness and making sure that lung cancer is a cause that people care about and act on as well. And then the third part of the priority of the initiative is to raise critically needed funds. And as we've talked about earlier in the segment, there's such a need. So the Lung Force Initiative is really hoping to address that need.
And that's where you come into play with trying to get that funding, right?
Right, absolutely.
Is that difficult with it being such a disease that affects so many people and it being deadly, I would imagine?
Yes, and it's a hard one. And so generally lately, or since the Lung Force campaign, I should say, we've really worked hard and pushed on the federal level to try to get more funding through the National Institute of Health to fund cancer prevention, treatment, and diagnosis funding. We want to see that. And lung cancer has really made some great progress in terms of people's outcomes in just the past few years. We've seen really great progress in research. So, like we said, it's the #1 cancer killer of men and women in the US, but even 10 to 15 years ago, I mean, you got that diagnosis and you didn't have very long to live. Now we're seeing more people live longer, and it's really due to that research and that funding. So we, as part of our Lung Force campaign, we have an advocacy day where we bring people who've been impacted by lung cancer and go to Washington, D.C. and talk to our lawmakers, really just advocate who amongst us hasn't been impacted by lung disease. We really need to invest in this because it saves lives, it improves people's quality of lives, and improves the economy. I mean, when you have more people in the workforce and doing important work. So it seems like an easy ask, but not necessarily always happening. But
right, there's a limited amount of money that has to be spread everywhere.
Exactly, but I think we are making some big progress in getting more information about lung cancer and getting people connected to that.
All right, we're going to take a break and we'll be right back. You're watching 22 News in Focus. It's 22 News in Focus. Today we're talking about lung cancer and other lung diseases, their prevention and treatment, as well as support for family, friends, and patients of people with lung diseases. So we were just talking about one of the programs that you offer and the struggle, I guess, to try to get money for this important topic. But what is Saved by the Scan? That's something else that your organization has as a campaign. What does that do?
So our organization is honored. We recently partnered with the Ad Council for Saved by the Scan. So maybe you've seen some of the videos or the advertisements that we have out. But basically, we're trying to raise awareness about low-dose CT scans and for people who are at a high risk to get lung cancer to have those scans. As the doctors were talking earlier, one of the big things with lung cancer is that it's not caught early enough. So it has a really low survival rate outside of, to be living within 5 years after your diagnosis. Oh. So we're trying to drive people to savebythescan.org if they're at high risk, and what that means is if they're between the ages of 55 and 80, and if they're a current smoker or have quit smoking in the last 15 years. So if someone, thinks that they should, have a low-dose CT scan and really want to be preventative and on top of lung cancer, then we tell them they should really have open conversations with their physicians about their concerns and visit savebythescan.org. There's a quiz on there to see if it is something that you would qualify for.
What about the expense of it? Does insurance cover that? Is that something that people are concerned about and maybe a reason why they don't get a CT scan?
So some hospitals do have free screening programs, and then for other people it varies on your insurance and what they allow.
It is covered by Medicare,
yes.
though. So,
okay.
I think that can be a big barrier for people to access it, but we want people to know that it is available to them to go to their to this website if they think they're concerned. Because it has been estimated that if even half the people who are in that high-risk pool got screened, it could save like 15,000 lives.
Wow.
So that's a real big difference. And it's not like this big invasive test. So we really want to see people who are at high risk talk to their doctors. If they're even concerned before that, go to our website, savebythescan.org, and see what they can do to make a difference in their own health. It can be great.
And so when people are diagnosed with lung cancer, even though they are more likely to survive now from it than they were in the past, it's still something scary and something you don't want to hear, and for family and friends too. So are there any resources that you provide or direct them to help with that and make them feel a little bit better?
Yeah, so one of the great things that we have is our lung helpline, which is 1-800-LUNG-USA. People can call in and speak to a registered nurse, respiratory therapist, ask any questions. I feel like when you get a lung cancer diagnosis, it's a lot of information, and maybe you walk away from an appointment and think of something after, so you can always call our lung helpline. Our website has a ton of resources, but I think here locally, one of the great things that we have is a Better Breathers Club right at Bay State, and what that is anyone living with any type of lung disease, from lung cancer to COPD to asthma, can go to this Better Breathers Club, and they're able to it's a support group, so they can connect with other people who may be going through the same thing as them, but then also I know here specifically we have a lot of great guest speakers who come into those clubs and educate them on new advancements in oxygen and exercise if you're dealing with a lung health issue. So those are great support systems. Caregivers can also go to those groups.
Oh, okay.
So yeah, between our lung helpline and our website, and then always the Better Breathers Clubs are great systems that I think we have.
And there's events too, like I don't know if this is part of the American Lung Association, but I know every year there's the firefighters climbing all the stairs. Can you talk about what that is and how that helps raise awareness?
Sure. So we talked about kind of the education piece, but there's certainly something to be said about members of the community coming together and supporting each other that are all affected by lung disease. So we have a number of events, one of them being the Fight for Air Climb, which is a fun interactive event, and we have usually our local firefighters that participate and in the event with their gear as well, but it's an opportunity to support each other. We do have an event locally here in Boston and then also in Hartford. So I encourage people to take a look on our website at lung.org to see how they can become more involved. The other side of that, another opportunity, are our Lung Force events. So we have the Lung Force Expo, which is an additional resource. It's an opportunity for patients and caregivers to come together to support each other, to learn, exchange ideas, ask questions of the physician panel. So that's an opportunity as well for healthcare professionals. And then we also have our Lung Force Walks, where another feel-good opportunity for people to support each other, come together to fight lung disease, to fight lung cancer. And so we have that locally happening here in Massachusetts as well during the spring, and then also in Hartford, Connecticut during the spring. So there are a number of opportunities for people to connect, to learn, to support each other. And again, we just encourage folks to visit our website at lung.org to learn how they can become more involved.
And would you say that each year your efforts are making the walks and all of those programs grow? Are you finding that more people are participating year after year, or is it difficult to get more people involved in these kinds of things?
So I think it's a multi-pronged approach. I think as we continue to partner, see the success of the Saved by the Scan program and increase awareness, then more people will come forth and become involved in the events. We're certainly, have our grassroots efforts to get people of all ages involved. But we are seeing progress, and only look forward to continuing to grow those efforts. Because again, it is a feel-good moment, but it's also an opportunity to raise critically needed funds for research. So people are truly making a difference when they're involved in the different activities.
And most of your money is from fundraising, I'm imagining, but also the government. And do companies and organizations donate as well? How is it kind of divided when it comes to funding?
So we partner with companies. We're always looking for more companies to come on board and support, whether they have a personal connection or they want to support their employees, because we talked again about the prevalence. So, most often there are employees that are impacted by lung disease. So we partner with local companies, whether it's tabling events, sponsorship opportunities, teams, but encourage everyone to kind of step forward and to fight lung disease along with us.
Right, excellent. We're going to take another break. When we come back, we'll talk about education, and particularly about smoking and what you're doing to tell people the dangers of smoking if they don't know already. You're watching 22 News in Focus. You've been watching 22 News in Focus. We're talking about lung cancer and lung diseases this hour, and we're talking to representatives from the American Lung Association about the many programs out there, but also education, as you've said, is key to preventing some of these diseases, or at least making the risk of having them lower. So one of the major things we've talked over and over again this hour is about smoking and how bad it is. But what are you doing as an organization to get that message out there to people who might not know that smoking is this serious of a problem?
So I think one of the main things that I know I'm working on is trying to ensure that there's funding throughout the state to actually provide prevention programs. And so that's something that we can do broad scale to really make sure that it's happening throughout the state. So we're really advocating to ensure that there's an investment. We know that people who are smoking are paying taxes on those products. So we want to ensure that if they want to smoke, or if they want to quit smoking, they have the resources available to them to help quit, and also ensure that people don't start. So that's a big way I feel like that we can make big policy change, where the Lung Association can do plenty to talk about this, but there's also opportunities on a broader scale to make sure that this is happening, and not just dependent on the work that the Lung Association is doing. I know I was hired originally when I started working for the Lung Association to do a program where it was about teen empowerment and having teens talk to other of their peers to keep them from using tobacco. And so that was pretty successful and worked really well. And so I think we're always trying to find more initiatives and ways to get more people involved. And I don't think that it's a surprise at this point in 2017 that smoking is not a healthy choice. And so we work on some aspects of prevention is really important. And we have opportunities for people to stop too. So we have programs like our Freedom from Smoking program that really helps and encourages folks to quit. We have a Not on Tobacco program that really helps teens quit smoking as well. And so there's lots of ways that we're engaged in ensuring that people have the resources and tools and information available to them to not start, and if they are using, that they have the help to really stop with the addiction, because it's a challenging thing to quit.
Yeah, and what are some effective ways for people that you say for people to quit smoking? Obviously, cold turkey isn't probably the best way for people.
So like Ruth mentioned, our Freedom from Smoking program is a program that we actually offer online and in person. We train facilitators across the country to run that program for us, but it's kind of like an in-person support group where you go to sessions and you talk about maybe why you do smoke and the reasons you have to quit. And we do a variety of activities, and then the group quits together as a group, as a part of the group. So it's a great program. If people want to learn more about that, they can definitely visit our website to find where they could join that, as well as, like I said, we do have an online component to it now. We're trying to be with technology, so we do have that available online, Freedom from Smoking Plus. So.
And the FDA has many approved cessation help, so that can be pharmacological help, the nicotine patches that people see. So those are all approved by the FDA as ways to help people smoke, and through therapy like Freedom from Smoking support groups, but also individual and group therapy can also be very helpful ways for people to stop the addiction.
So does the American Lung Association work with the FDA and side by side with hospitals and in coordinating that and making sure that these programs are reaching the right people? Or are they kind of separate entities? How does that work?
Well, the FDA is a governmental organization, and so we don't necessarily work directly with them, but we do, if a product has gone through the process of getting approved as a cessation help, then we advocate that people use that, and so we know that that's gone through the process. That's important. So yeah, those are separate, but we recognize the work that they're doing.
And do you go into hospitals and talk to patients who are, like the lung section of the hospital, so to speak? Do you talk to patients and family members there and put out brochures on those services that you provide? How do you reach those people?
So we're always trying to have partnerships with hospitals and with pulmonary departments. So just working with them to educate them about the resources that we have. So, a lot of hospitals, we do have a partnership, and they come to us and they want people trained in their hospital to run our Freedom from Smoking program, or they want to be able to, put out information about smoking cessation. So if they are interested in doing that, they can definitely contact us. We always welcome new partnerships.
What about asthma? It affects, I have asthma, you have asthma, so many people have asthma, and it's something that I feel like isn't talked about enough, because probably there are ways to treat it that are pretty effective, like an inhaler or a nebulizer, but it is something that really affects people, and people die of it. So what resources are available through your organization for people with asthma?
So we do a couple of different things. So one of the things that's a great resource is our website. We have asthma action plans available on the website. It's a great way to work with your doctor to come up with a good plan in case you are dealing with asthma, knowing when and how to use your different types of inhalers. The other great thing that we're doing, and we actually just got a lot of funding for this locally, is to run a program called Open Airways for Schools, where we work with a school nurse, have them certified in this program, and they can work with students in their school to really get them educated on asthma and learn about how to deal with their asthma at a young age.
As someone with asthma, if you don't mind sharing, did you find that growing up or whenever you got it, there were enough resources out there for you to be educated on what it means and how to get treatment and make sure that you don't suffer too badly from it?
At the time of my diagnosis, which was later in life, I worked really closely with my physician. It certainly came as a shock, because initially I had really kind of thought of asthma as something that you grow up with, so it was shocking to me, but I have learned through listening to my physician, in terms of the management with the medication, to keep it managed, and when you have those bad air quality days, to make sure that you listen to the advisory. So it's all about being kind of equipped with the information, and just being proactive and managing your symptoms to have quality of life.
And that's something we haven't talked about at all, is the air pollution and air quality. I think we're looking at video of that right now. And I know from previous stories we've done that Western Massachusetts has a problem with air quality, at least compared to other parts of the state and country. So does your organization work with that and trying to make sure that the air isn't polluted and there aren't environmental factors that make it worse?
Absolutely. We have an annual report that we release throughout the country called the State of the Air Report, and what we do is we get grades based on air quality monitoring that happens throughout the country, and kind of put that information and give each county a grade so it's a little bit easier to digest that information for the public.
So you're the ones who do that. Okay.
So we do the state of the air report, just trying to get people to know about what the quality of the air is that we breathe. And we really track like ozone pollution and particle pollution, and try to get people to know what the health risks are of exposure to those things, because lung cancer is caused by air pollution, and air pollution can also exacerbate asthma symptoms, all kinds of things. So we're really concerned about the quality of the air that we breathe, not only the health of our lungs, but what we're putting into them, right? And so that's very important. And then on a state and national level, in terms of policy, we're working to do all that we can to make sure that the air that we breathe is healthy and clean.
And we were talking about the stigma surrounding lung cancer and probably other lung diseases as well. Maybe that's something that is leading to people not knowing as much about lung cancers and diseases as other ones out there, like breast cancer, for example. So how are you trying to break that stigma surrounding lung cancer?
So as part of the Lung Force Initiative, we do have our Lung Force heroes who are personally affected by lung disease. And so they're sharing their story in the hopes of inspiring others to step forward and share their story. We do recognize that there could be some stigma attached to it, but certainly we're here as a resource to support folks when they do get that diagnosis and support their family as well. So the Lung Force Initiative is really aimed at acknowledging that and working to minimize that so that people feel comfortable in stepping forth and accessing resources that they need.
Yeah, because you were saying during the commercial, not everyone with lung cancer is a smoker.
Right.
Right.
Yeah, and so there's a lot of risk factors associated with lung cancer, and if you have lungs, you can get lung cancer, sadly. And the other thing is, no one deserves to get lung cancer, right? And so we want to make sure that people notice that this is a big risk, not to scare everyone, but if you think that you're at high risk, talk to your healthcare provider. And some of the risks include, like we said, smoking. So that one of the best things you can do for your health is, if you are smoking, quit. If you're not, don't start. But secondhand smoke exposure, air pollution, and radon is one thing that we didn't talk about as well. But that's the second leading cause of lung cancer. And so that's the thing where we definitely encourage people to test their homes. It's easy to do. Or if they're spending time in a lot of time in workplaces or schools, try to encourage that those get tested for radon.
Very interesting. Thank you, ladies, so much. We have all of that information as well on our website if you missed it, and we have the last word for you after the break. You're watching 22 News in Focus. Watching 22 News in Focus, and today we've been talking about improving lung health and preventing lung disease as part of Lung Cancer Awareness Month. So that's our program for today, and we want to thank our guests for joining us, and thanks to you at home for watching. If you missed any of it, you can watch it in full on our website at any time at wwlp.com. We'll have links to all of the resources there as well. And from all of us here at 22 News, we wish you a wonderful Sunday.